Welcome to the second episode of clinic episodes of the DHS Demo version 2 series. And on this episode, actually, we are going to talk about doctors' activities in the clinic, because we have already done with nurses' activities in the clinic. So actually the method or procedure of accessing the clinic remain the same with the nurses. In case maybe you haven't seen the video for the nurses episode, I will advise you to go and check that very episode of the bureau. At least it will get you to have an idea of this a hint, an introductory aspect of this very episode that we are going to take. So I will quickly go to the GOPD2 clinic. If you can recall, we have already booked this very patient to this clinic, and nurses have done their own aspects, and you can see that under the status, the system is showing the patient is awaiting for consultations, which means the nurses have already done their part, and right now the patient is awaiting for the doctor to attend to him or to attend to her. So as I said earlier or in the previous episodes, if you want to consult or if you want to respond or attend to this patient, all you need to do is to click on the actions button that correspond to the patient, patient's name. So I will click on it, and after clicking, the system will allow me to have this actions menu. And remember, I will work as a doctor, and what the patient is expected is to get consultants, so the doctor can use the consultations menu of the actions menu to attend to these very patients. So by clicking the consultations menu, the system will take you to this dashboard. Ideally, this dashboard is for the consultations, is for the doctors only to be able to run any consultations activities. And before going to these consultations in detail, I want you to maybe consider this area that I'm highlighting. Actually, as you can see, the title of this area is recent vital taking. Actually, if there is any vital taking, the last one the system will show here, despite the fact that there is a window whereby the doctor can check all the previous vitals that had been taken. But this one actually will show for the doctor in this area, for him to be able to get hints, information about the patient vital. And also we do have these sections with the title non-allergy. So if there is any non-allergy for these patients, the doctor can be able to register it, so that anytime when the patient comes to the hospital, and if any provider search for this patient profile, will see the number of allergy indicated by ProPatient as the patient's, indicating that the patient's allergy to those information. Maybe probably, I'm not a doctor, but maybe I can say this patient is allergic to maybe diclofenac. I can click on add. So anytime the profile of this patient is open, you will see this. If there is any additional allergy, I can keep on adding, and any other doctor can also add such information. And there are other bio information that maybe will help the doctor in terms of, or maybe the doctor will have some hints while treating the patient or consulting the patient, like for instance the genotype, the blood group, HIV status, maybe the patient is asthmatic. So once indicated, anytime you open the patient profile, you also see them. So these sections, these three sections, actually we can call them a hint panel or hint sections. So it will just give some vital information to the doctor, or the doctor will register some vital informations for these patients against subsequent consultations, things like that. So let me start the consultations appropriately. So normally during the consultations, doctor used to document the informations they are asking, or they are observing, or they are examining from the patients. So, and then they normally do clicking clicking the information into a sheet. That is, I'm talking about the manual record system. In the computer system, we actually is just the replicate of the manual one by simplifying the whole process. So in order to do clicking, all you need to do is to click on the clicking tab, and we do have different template of clicking considering the specialty among the medical fields. So we make some provision, actually make provision of some template. Like for instance, we do have general template or review template or eye template. That is in case of ophthalmology consultation. We have the physiotherapy on dental, antenatal, orthopedic, immunizations, things like that. And keep in mind that if there are any other template that is not included and you are in need of it, you can just go ahead and tell us we need so template, and if you have the hard copy of the template, that will ease the process for us. You just share with us the template and we will build the template and integrate the application with the template, and you get your template ready anytime you are in need for. So for instance, if I start with the general template, you can see all the sections that's supposed to be in the general template. You see them available. For instance, we do have the presenting complaint, history of presenting complaint, first medical history, family and social history, gynecological history, physical state examination, mental states, diagnostic and differential, and your plans, and click on save. And also maybe during what round, or you don't want to follow this detailed consultations template, you can use the review. The review will only give you a field like this, a plain field where you can type whatever you want to type and click on save. Or maybe you may probably want to use maybe eye template, and this is it. I believe the specialty there, once they see this template, they know how to handle it. Or maybe probably I want to use the physiotherapy or dental. As you can see, let me select the dental. We do have the complaint where you can write the complaint, or and then the assessment, the tooth or the cut of the tooth you can indicate, or the organ, then the problem, the recommendations and the interventions you have done, and you can click on add if there is any additional affected organ that you have maybe assess. Then you can repeat the step. The system will add the thing down like that, and after that then you can put your general plan and recommendation and click on save. And also maybe probably you may need to, maybe in case of antenatal, you may use the antenatal template. The system will give you this field. We have the initial visit. Ideally in the initial visit there are some vital information that need to be registered for any antenatal or pregnant women, like for instance the information about the gestations. And in our own case, actually we provide the gestation information sections in the consultation ANC consultation template, and we split the gestational informations into two. We have the conceptions and then the expected delivery informations and other information. Sorry, I say two, but rather actually we have three sections. So in the conceptions, if the ovulation date is available, you can indicate, or the LMP is available, you can indicate. And this one actually you cannot do anything except maybe if you ask the patients to go and do the ultrasound scan, and in that very ultrasound scan we have the expected delivery date, then you can indicate it somewhere here down here, and then definitely the system will project back the expected date, the pregnant woman expected that conceived the pregnancy. And also you can use this field to indicate the gestational age at first ANC visit. I think is part of the vital information that's supposed to be registered while attending to the pregnant women. And let's say for instance the patients before me said her last LMP was on the 1st of June 2024. So as I click, the system will do it based on the provisional formula to calculate the expected delivery date based on this LNP information. As you can see, the system is saying the delivery of this pregnancy is expected on Saturday, 8 March 2025. And not just that, if we come to this area, the system is saying that the delivery is expected, or the pregnant the patient is expected to deliver at week 40. And also the system is also telling us that this pregnancy presently is at week 15 gestational age. So you see, as you are imputing, the system actually will assist you in making any calculation that's supposed to, maybe you're supposed to do, it will do it. And it will not just do it, it will do it based on the provisional formula. So which means anything it shows here expected, there are no error, except maybe during imputing, maybe probably as you are entering the data you mistakenly enter something. And also, if these other vital informations are available, you can indicate the variety, gravida, number of stillbirth, things like that. If previously this information has been recorded for this patient, automatically the system will pop the information up like this. Here, as you can see, the parity is says 0. Maybe probably the patient has not. This is the first time the patient has this pregnancy. So the system will show 0. But if there is any record of parity previously, then that very record will appear here. Then you have the power as a doctor to adjust. Maybe if there is require, if it's required, I mean. And then the next thing is maybe the antenatal vital. As you can see, the nurses normally took the vitals during the antenatal clinic. They used to maybe do some clocking, things like that. Let me just hide these sections and focus on the other sections. Clocking and appointment. If it require an appointment after this clinic, maybe you want the patients to come to maybe next 2 weeks, you can indicate the clinic and the date that you want the patients to come for follow-up. Or maybe the patient come to your clinic for ANC, and maybe you see some other problem that require specialty in other clinics. So you can refer the patients to that clinic by just selecting the clinic and selecting the date that you want to see the patients. Then the patient will be booked there as a referral from your clinic to her clinic. And while doing that, you need to maybe write the complaint, the reason why you are sending the patients, just for the doctor to have a hint of the reason why the patient is being referred to their care. So basically that is for the antenatal template, and we have the orthopedic immunization template, things like that. You can indicate maybe the kind of vaccines taking, the date, in case if you are dealing with a child, you can indicate the child weight, and then the age of the child at the point of the taking of the vaccine. And then the system will automatically plot the child weight graph for you to monitor the child weight, the child nutrition's effect graphically. So things like that. That is for our antenatal the consultations template. And keep in mind, while you are clicking, remember each sections that you see save, please click on save. And when you click on save, anytime maybe the power goes off, maybe or the network or things like that, you can always come back and continue from where you are. Actually, the system will automatically make this documentations you have done as a draft. So anytime you can come back and continue from where you are. But keep in mind, the draft consultations uses the grace period given by the system administrators. Assume that if the system administrator has given maybe the draft consultations will only last 12 hours. So you should try your best to finalize your consultation within that very 12 hours. Otherwise, the system will penalize to you. And the panelizing of the system, there are maybe probably some information that they are vital or they are utmost important to be part of the consultations, but actually the system will not consider that, will just panelize that very consultations without actually adding such information. So you see, panelizing the consultation yourself is very, very important, just to avoid this. And in some hospitals that they normally pay doctors based on maybe performance formula, then definitely you may not get advantage of any consultation that you have done, but you have not panelized it, because it will not tag under your performance, but rather it will be tagged under separate performance that will not benefit you. So panelizing it is very, very important. And also, after the clicking, maybe you want to post the prescriptions or some drug prescriptions to the pharmacy, so that the patient can go there and get the drugs. So all you need to do is to click on the drugs, and under the drugs and consumable, you can indicate the name of the drug. Let's say, for instance, Augmentin. The dosage, let's say 625 milligram, and then the frequency, let's say BD, and the durations, let's say for 4 days. And if I have any starting dose that is different from the recommended dose or subsequent dose, I can indicate here. Otherwise, I can leave it blank. The system will also accept. So I have added, and if there is any other thing like maybe paracetamol, as I start typing, the system will keep on showing the most relevant drugs based on my input. And not just that, the system will show the availability status of this drug that I'm typing in the pharmacy store. As you can see, as I'm typing like this type paracetamol 500 milligram, the system, it says there are about 10,000 units available at dispensary. So I can click on this and click continue. The system will try its best to give me hints that whether this stock is available or not available in the hospital. So I will just write anything I want, even if, like, for instance, let's say I put something like TAF diclofenac, let's say 1 gram. And as you can see, there are no any recommendations or hints given by the system. I can ignore that very hint and continue with the dispensing. Let's say 1G here in the dosage, and then the frequency is TDS for 2 days, and click on that. So basically that is it for the prescriptions. And also for the prescription in case if there is any indications of interactions as you are prescribing, the system will automatically pop up. Like since there are no interaction, I can click on the check interactions. The system will show me the interaction status for this. As you can see, drug to drugs is 0. What I mean by drug to drugs, maybe probably in these prescriptions, maybe you have prescribed paracetamol, and maybe probably you have also prescribed Mixagrip, and I believe inside the Mixagrip there are 500 milligram of paracetamol. So if the patient is going to take those prescriptions at once, the patient will end up doubling or overdosing paracetamol. So in that case, if the system sees that, then definitely under drug to drug it will rate and the number of issues detected. The same thing if the drugs given to this patient or prescribed to these patients has some issue with the patient diagnosis, it will also plaque rate and indicate the number of issues detected. So that is it. And if you want to send for laboratory investigation, all you need to do is to give some clinical details, like for instance, the patient is having malaria, and down here you can specify the name of investigations you want to be conducted for the patient. Let's say like urinalysis, and your prepared sample, maybe I need urine, and also remember, if any investigation that I want it to be urgent, I can switch from is emergency no to is emergency yes. And let me put like something like food blood count, and then let's say the sample is blood, so I can write the name of my sample that I want the scientist to use in order to run these investigations. So the same thing with the radiology. If I need any imaging investigation, I can write the clinical details of this patient and select the kind of imaging investigations I want to be done to these patients. Maybe I want to have like let's say abdomen AP, and I can click up add. If there is any other additional investigations, I can add. And also maybe I mistakenly added and I don't want it to be part of the request, so I can click on this trash box. It will clear the request. And also if there is any procedure or surgery required for this patient, I can also order for that or request for that using this template. I can write my write-up here, and I can put the kind of procedure or surgery the patient is in need for. Like for instance, I put this partial denture, and I can click on that. On add, it will be added. Also, if there is any requirement for blood request, I can select the kind of product I want and then click on quantity and click on add. It will add the request to the appropriate department. And let me skip this history. I will come back to it. Let me check for orders, and in the orders, the doctor may use orders to register new vital, or admit the patient, or discharge the patient in case the patient is under admission, or refer the patients to maybe another clinic or another hospital. So let me start with the since we have done with the vital in the last video, I will just go ahead and do the admission. As you can see, this is the admission form. So once I click on the admission, the system will allow me to select the ward I want to admit the patient. For instance, I select private ward 1, and if there is any bed available, it will show. As you can see, the capacity is 2 bed and no bed is available. That's why under the bed I have empty drop down list. Let me check another ward. It seems most of the ward have patient have already occupied. This private ward 4, there are 2 beds are available, bed 1 and bed 2. So I will select bed 1, and I can decide to admit the patient based on observation or full admission. But keep in mind, if you admit patient under observations, once the admissions cross a day, then the system will automatically convert the observations into a full admission. So I will click on admit. Remember, this patient, we are going to admit this patient to private ward 4. So I have this acknowledgement patients admitted successfully, and after that I can always either go back to the queue, or by clicking on back, it will take me back to the consultations dashboard. So after that, let me also go back to the orders and click on refer in case if there is any need of referral. So in the referral, all I need to do is to click, is it internal referral or external referral, and I also need to specify the diagnosis. And in case of it, if it is an internal referral, it will allow me to select the clinic that I want to refer to the patient. But if it is an external referral, it will allow me to enter the name of the hospital I want to send the patients to, and also the purpose or the services that the patient are in need for, expected to have in the referred hospital. And also, if the patients belong to insurance patients, I believe most of the insurance patients require authorization code for any referral, and if it is given, I can click on submit, And then if there is any other previous referral done to this patient, I can see the list in the table below here, and I can be able to select anyone and click on print in case if we are in need of printing the referral form. So I think with this we can finalize these consultations. And the way you can finalize consultations actually is by clicking on finalize, and under the finalize you will see this template. We have the primary diagnosis, secondary diagnosis, primary diagnosis with some secondary diagnosis if require. So let's say this is the diagnosis of this patient, and then I can click on, if there are any secondary ones, I can click on submit. If there is, also. But right now the system is saying something, I don't know what it's saying. You cannot finalize consultation without clicking, actually, because I haven't done any clicking. I just say make explanations without actually writing anything and saving anything. So let me just write this blah blah and click on save. So let me go back to the finalize. So let me go back to the finalize. Sorry. So, and to finalize, I will click on submit, and if everything were right, the system will automatically take me to the waiting list. As you can see, even the color of this patient in the list has been changed to orange brown, and also the status is also changed to consulted. So basically that is what we have for the doctor in the clinic. Thank you. And keep in mind that if you do have any questions or contributions, observations, you can send to our email at info.ipsoncar@gmail.com, or you can leave a comment under this video. And also, if you do have anything, maybe if you are in need to chat us via WhatsApp, you can also use our WhatsApp number attached to this account and send us a message or your observations.